Good morning, and welcome to the Shatkin First Monday Morning Minute.
Hi, I'm Dr. Todd Shatkin, and welcome to this Monday Morning Minute. Today I want to speak to you about the importance of using surgical guide stents and proper preoperative planning for your mini implant cases. It is paramount to have proper planning, and the only way to do that is to thoroughly review the x-rays, the models, and plan exactly where you want to place the implants. The very best way to do that is by using a surgical guide with a 3D surgical CBCT stent. The way to get a surgical stent, a 3D surgical stent, is you have to take a cone beam CT scan of the patient. If you don't have a cone beam in your office, you can either send the patient out to get one, have a mobile CT company come to your office or to the patient's home to take one, or you can purchase a cone beam CT for your office. Of course, Shatkin First sells, I feel, the very, very best of cone beam CTs, the Papaya 3D machine, which I use every day, dozens of times a day. I really don't think I could go back to a panoramic x-ray after having cone beam for the past 8 years in my office. It is just phenomenal the amount of information you get from a good quality CBCT scan. So if you take that CBCT scan and you send it in to Shatkin First, we will then take your models, your cone beam scan, and merge those together to make a digital model and be able to place the implants in that digital model here in our laboratory. From that, we will print a 3D model on the 3D printer and then fabricate a surgical guide stent over that 3D model that looks something like this. And we can do it from anywhere from one tooth to a whole arch of teeth to for an upper denture stabilization or a lower denture stabilization or a roundhouse bridge. And by doing that, we're also able to fabricate a restoration that would go on the patient's mouth on top of the implants in a precise, pre-planned position, whether it's a single tooth, multiple teeth, a denture, or a bridge. And in rare cases, we might even do a roundhouse bridge in one visit using a surgical guide stent with 10 to 12 implants. But usually, we make a temporary bridge to place at that time so that you can put the implants in, take your final impression, and then make your final bridge. These are all the reasons why you should use a surgical guide when placing mini implants. But most importantly, medical legally, you've got a pre-planning done with a surgical guide stent. If you ever run into any issues at all, you've gone through the proper process and due diligence to treat that patient. And you want to document all that, and you want to keep the surgical guide stent with the patient's name on it in a sealed bag so that you never lose it. And you keep it as part of the patient's models and records, at least for the minimal amount of time that your state requires you to keep records. In New York State, it's 7 years. So I hope this information was helpful to you, and I look forward to talking to you next Monday on the Monday Morning Minute. Thanks for joining me.
Hi, I'm Fitz, and I'd like to remind everyone, this year, out in Las Vegas at Caesars Palace, on June 22nd and June 23rd, we're going to be having our International Academy of Mini Dental Implant Symposium. This is over a 20-year academy full of the smartest minds in implantology. And we're thrilled that Dr. Gordon Christensen will be our keynote speaker this year. We also have Dr. Dennis Flanagan, a very well-respected, well-published implantologist. He's a wonderful educator. So be sure to join us out in Las Vegas on June 22nd and 23rd. Love to see you all there. And don't forget, Shatkin First will be celebrating its 20th year in business down at the Magic Kingdom in Walt Disney World on August 4th and 5th. Dr. Gordon Christensen will be our keynote speaker all day on August 5th. So he's going to give a wonderful presentation on the state of mini dental implants, why every single general dentist in America should be placing them. And we just received great news too. Dr. Thierry Giorno, the inventor of the Intra-Lock mini dental implant and a very huge proponent to LPRF and Intraspin, will also be lecturing with us in Disney. And Dr. Samuel Shatkin will also be giving a lecture on Botox in dentistry, which is excellent. So between Dr. Gordon Christensen, Thierry Giorno, Samuel Shatkin, and Todd Shatkin, we got a pretty heavy lineup down in Disney. And we look forward to seeing everybody down there. And keep in mind, Dr. Shatkin has invited all of our existing and loyal customers at Shatkin First down to our Disney course at no charge, absolutely free. So please take advantage of it. Come down and see us. And it will be 2 days of excellent, excellent education, the best in mini dental implant training anywhere in the world. And we'd like to tell everyone about our June implant special, the mono dental implant, both bendable and non-bendable. Keep in mind, you buy 25, we give you 5 free. You buy 50, we give you 10 free. You buy 75, you get 15 free. You buy 100, you get 20 free monos. That can really, really help the bottom line at your dental practice. So take advantage of the mono dental June special. It's a wonderful implant. If you need to learn more about it, come to one of our upcoming courses and we'll teach you everything you need to know. Look forward to seeing everyone on next week's Monday Morning Minute. Have a great week placing implants.